Hello everyone, my name is Ethel and I will be discussing confidentiality and privacy of patient information. I will also outline some key points made in a briefing from the video on how celebrity health workers were accessed without permission. In the briefings or in the notes of the video, there were several employees that went into celebrity files and had access to their personal information. One incident happened with a head nurse who was using her pens to go in and search for information, and she had been doing this for years and years. This is all fault due to the hospital and her supervisor for not going back behind her and checking on her work. Another incident was several employees were just going in and able to access celebrity information by just typing in their name, and automatically all of their information would come up, including social security numbers, addresses, things like that. There was no type of encryption to hide the first part of the social security number, or to hide their phone number, or to hide their addresses. So the hospital was found at fault, and demands were made for them to be fined. There are different types of Web 2.0 tools used within healthcare. Web 2.0 is described as the new age of internet, a higher level of information sharing and interconnectedness among participants. There are several types used in healthcare, such as podcasts, RSS feeds, health blogs, and social networking. Social networking is a huge one that has been used within healthcare, because it includes such things as Facebook and Instagram. Patients have rights and must be able to freely discuss personal information with their providers. Information technology has the potential to improve the quality of care by using instant retrieval and access methods, such as emails and Messenger. And through Facebook, you can easily contact someone through Messenger. But there also must be a waiver and a disclosure signed and mutual agreement that the information can be shared on these sites. According to the CDC, privacy refers to the right of an individual to keep his or her information private. Confidentiality refers to the duty of anyone entrusted with health information to keep that information private. Maintaining privacy and confidentiality of patient personal information is very important, especially in healthcare. The Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, privacy rules, seeks to protect individual health information from compromising issues. A patient has rights whether the information is on paper or being held electronically to feel safe and secure that this information will not be accessed without their permission. Ways used to protect patient information. There are programs and rules and organizations that help control protected health information. Protected health information is protected under HIPAA laws. Healthcare organizations are liable for breaches. Patients are given rights which empowers them over their own health. HIPAA is a rule set back in 1996 with a privacy rule. The omnibus rule was also outlined and guided through HIPAA, and HITECH Health Information Technology for Economic and Clinical Health Act. Follow the omnibus rule. As a manager in healthcare, certain obligations must be fulfilled, especially when dealing with patients' personal information. A good way to protect patients as well as employees is to have as many training sessions as possible. Whenever new policies are released, managers should personally contact department heads and send the information through emails, preferably encrypted emails, detailing all of the information and ways for them to train their employees. Healthcare managers are obligated to maintain patient information private. Confidentiality is a huge concern. Managers have to be properly trained on handling personal patient information so they can train other staff. Training can be done by having monthly meetings with heads of staff, guaranteeing all information is covered, especially when new policies come out. Managers are responsible for allowing limited access to patient information, especially without consent. They also have to make sure all personnel are educated on confidentiality and privacy rules, notifying all of any violations if breached. There are different types of protected health information that need to be protected at all times and remain confidential. Treatment information, patient diagnosis, test results, demographic information, including birthdays, social security numbers, gender, telephone numbers, and email addresses. All of these protected health information should remain safe and secure with security guidelines that follow. This concludes my presentation. You all have a good day.